Good morning, everyone. It is 8:01 a.m. on September 26, 2023. I'm going to call the Board of Health meeting to order. Present, we have board members Terry Quell, Joan McNeil, Ken Lalim, and Janet Karpiak. And we have staff members Bill Mooney, Aniela Fignon, Megan Fogno, Brian Weeks, Pam Bates, and myself, Deanna Diamore. Good morning, everyone. The first item on the agenda is the approval of the August 22nd, 2023 meeting minutes. Do I have a motion?
So moved.
Harry moved. Do I have
I will second it.
Thank you. Joan has seconded. Terry sent a comment about the minutes that we can. So at the beginning of the meeting, Terry had been on her phone, so I don't think it said like a quorum was not present, but a quorum actually was present. So Terry had suggested to delete that. I think we can delete that sentence from the minutes, if that's okay with everybody.
Fine.
Okay. All right, so do any other further discussion on the minutes? All right, all those in favor with that correction, that revision, say aye.
Aye.
Any opposed? Any abstentions? All right. The minutes approved. Thank you.
I don't think she's gonna.
The next item on the agenda is immunization action plan, childhood immunization. So we are joined this morning with Pam Bates, who's the coordinator of our immunization action plan program. She's going to give updates on her program and childhood immunization rates, and I believe some of the other staff members are going to be participating in this update as well. So Pam, I'm going to pass it on to you unless Megan, you want to do any introductions. Well, I'll just say, Pam really is a true rock star. She is well known across the state as a true leader in childhood immunization outreach. The state really trusts her, and they ask a lot of her, and she always delivers. And we in Norwalk are so incredibly lucky to have her. And since we've expanded into the Danbury region as well, but I'm so thankful for Pam and her work and the team that she leads. So Pam, I'm going to pass it on to you. Pam, we can't hear you. I don't know if, or I can't,
How about now?
Yes, now I can hear you.
Okay,
Great.
perfect. Sorry about that. Thank you for that wonderful introduction, Deanna. Good morning, everyone. I'd like to first acknowledge Megan for creating our slides. Thank you, Meg. To start, I'd like to provide you with a little CTWiz kind of background and update. As a reminder, CTWiz is our statewide, confidential, computerized information system that records all immunization doses administered to Connecticut residents. So now it is children and adults. If an individual chooses to opt out, they have to send a written request to the Connecticut Department of Public Health. All children born in Connecticut are automatically enrolled through state vital records, and also when their healthcare providers report vaccinations per state law. All other residents are also enrolled through their healthcare providers when they're vaccinated. There is a public portal now where people can access their own immunization records and print those. All vaccine providers are mandated by state law to report the vaccinations that they administer electronically, either through their EHR, their electronic health records, or through the user interface, which means that they have to data enter all the vaccines that they administer into CTWiz in real time. Before the COVID-19 pandemic, Connecticut's immunization registries, the first one was known as CERTS, only tracked preschool vaccinations. As CDC required all COVID-19 vaccinations to be reported to VAMS and the individual states' immunization systems in real time, this provided the impetus to have vaccination providers, including pharmacies, on board to the system And this was a step toward our immunization system meeting a national standard, which is to track immunizations for residents across the lifespan. So there was a deadline for the providers to onboard for electronic reporting, and that was March 1st of this year to be in compliance with state law. And so by the end of August, 2,412 clinics were reporting electronically. 1,755 of those were the electronic health records reporting. The rest are doing data entry. And there's still, as of August, 332 clinics were not yet compliant, so they weren't reporting, but some were in the process of testing their EHRs or for data entry. But this is constantly changing as the onboarding team continues to follow up and try to get those providers on board that have not onboarded yet. So we can move on to the next slide. CT-WIS is a vital tool for outreach and monitoring of immunization coverage rates in Connecticut. So DPH recently released the rates for children born in 2019. The first table shows the Immunization Action Plan program rates, which we'll refer to as IAP. The rates measure Connecticut WIS enrolled children who received valid doses only of the 7 vaccine series. So the 4 DTaP, the 3 polio, the 1 MMR, 3 Hep B, Hib, age appropriate, 1 varicella, and the pneumococcal conjugate vaccine, age appropriate. All of those received by age 2. And as you can see, our Norwalk and Danbury IAP area rates were the highest at 83%. The next slide, please. This shows the trend rates for the IAP areas, starting with the 2015 birth cohort. That cohort, the rates were measured using the CERTS platform, which was our old system. The rates starting with the 2016 birth cohort were calculated using CT-WIS. And as you can see, they dipped a bit. This was possibly due to the calculation method. Children who moved out of state but not noted in CT-WIS could have been a factor in the decreased coverage starting in 2018. Providers were new to working with the system and not familiar with the patient management process. So if children who moved out of Connecticut were not marked inactive in the clinic and in the state in CT-WIS, they still remained in the denominator and impacted the rate. Next slide, please. This shows the statewide trend rates for the 2015 to 2019 birth cohorts. And these followed similar patterns compared with the IAP area rates. And then we can move on to the next 2 slides. The first one shows the Norwalk area. That's the breakdown of the rates by towns in our Norwalk IAP catchment area. And that's for the 2 birth cohorts, the 2019 and 2020. Upon request for this meeting and our upcoming rapid community assessment in Norwalk, DPH provided us with the rate breakdown by towns and census tracts for the Norwalk area. So the Norwalk data rate breakdown for children born in 2020 is on there. The rates have not been officially released yet by DPH for those 2020 birth cohort rates. So we don't have that same information for the Danbury IAP area, which is the next slide. Those are just the 2019 rates by town. And then the next slide is a great visual of the Norwalk neighborhoods that Brian created when he dissected the census tract statistics that the state provided. So I'll turn it over to Brian to elaborate.
Thank you, Pam. Hey, good morning, everybody. I'll just do this really quickly. So this is just looking at the census tracts or neighborhoods for the city of Norwalk at the same kind of criteria, the 7 vac series up-to-date status by age 2. This is consolidating the 5 years 2016 to 2020, just so we get enough in terms of the volume, just so we can kind of compare the census tracts, because we're getting at a more granular geographical level. But as you can see here, the darker shades of green imply a higher percent up to date or uptake relative to those criteria. So if you look at the table in the middle here, you can see it's organized in descending order. So the highest percentage at 89.74% is Silvermine, followed by Spring Hill and Woods Pond. And then you can see that, in the lower end is actually like Cranberry 81.36%, Rowayton at 81.07%, and Woodward at 81.01%. But as you can see here from the general picture, everything's generally speaking for all the neighborhoods in the 80th percentile, which is really amazing actually to see that in terms of the data. And it really speaks to all the work that, Pam and everybody else has been doing in terms of addressing this. So I want to commend them in that regard as well, just looking at these numbers. But you can see, obviously, discrepancies there, which are small, but they're noticeable in the sense of when you look at the data. So 89.74 versus 81.01. But still, again, being in the 80th percentile is really awesome. So, again, very good work in that regard. But obviously, still, there's that we're not at 100% yet, right? And so, just something else to kind of keep in mind as well, because the impacts of the pandemic and all that kind of influence that. So with that said, that's just kind of the overview relative to the city of Norwalk. I'll hand it back to the team. And also, again, special thanks to the State Health Department for compiling this data for us to kind of look at it this way.
Thanks, Brian. We can move on to the next slide, just going through a few things that did impact these rates. Of course, the COVID-19 pandemic, people were deferring well visits and vaccination visits, or they weren't readily able to schedule them. But I do want to give a shout out to our local providers for implementing measures to see children safely during that time. They were having separate well and sick appointment times or separate offices for sick and well. They were vaccinating in parking lots. They really did a great job. The rapid onboarding of clinics also impacts data quality. Duplicate records can be created if names or demographic information doesn't match up. Incomplete immunization records were imported as full legacy loads, or all the historical immunizations didn't come through to the system. As I mentioned before, if children moved out of the state and weren't inactivated by the providers, they remained in the denominators. And just bear in mind that the rates are a snapshot in time of the data that's constantly flowing into the system, and the cleanup and outreach do lag behind. We also now do have several other states that report to our system too, so we have all that data coming in for any Connecticut residents. And then our next slide, it's just showing what we do to engage in what activities we engage in that are focused to improve rates. When the clinics onboard to the system, they no longer receive these paper compliancy reports from DPH for children who are missing vaccines who are under age 2. So as soon as our providers onboard to the system, we train them how to run reminder recall reports in CTWiz so that this vital process does not stop. We request that they recall late patients promptly, develop a system to inactivate those who have moved or transferred, and we ask them to send their reminder recall reports to us for review and follow-up if necessary, until children are brought up to date. And then we provide outreach to children who are lost to follow-up. So providers will refer patients to us who are difficult to reach or are non-compliant with their visits. And then through outreach reports we run in CTWiz for our catchment areas, we follow up on children without a medical home to ensure that they are connected to a provider and that they are up to date. So our outreach efficacy rate is 100%. And then the last slide is just the new love of my life, my new granddaughter. She is fully vaccinated.
That's funny.
Pam, that's wonderful. Beautiful.
Oh, that's good.
Thanks.
Very much.
What a way to end a presentation.
She can be the official mascot of the program now.
There you go.
Thank you so much, Pam, for that really great presentation. Does anybody have any questions?
Great presentation, Pam and Brian. Thank you for that information. Could you just remind me how we ended up with Danbury also? I just don't recall that. I know we've been with them for a long time.
Right. The Danbury area lost their host site, basically. The coordinator retired, and the Danbury VNA or whoever hosted it no longer wanted the program. So then they were reaching out to the Danbury Health Department, who wasn't able to take it on at that point. And they were talking about it at state meetings. And I thought, well, you know, our hospitals are in the same system and whatnot.
Yeah.
Maybe it's something to think about. So unfortunately, I was the one who suggested the idea. And then we did take Danbury on, which has been great. I love the Danbury area. I love the providers. I love working with them. It would just be nice to have a little more staff on board.
Yeah, that's great. Thank you for that. Now that you tell me that, I kind of remember it. Yeah, thank
Yes.
you.
Sure.
That's great that we can offer that service for them.
Yes, exactly. Exactly.
Well, thank you, Pam. Thanks, Brian. Wonderful
welcome.
presentation. And amazing work as always.
Thanks.
All right. The next item on the agenda are the flu clinics. So Megan's going to give an update.
Sorry, good morning. I was just switching over. So I'm going to show a flyer that we have developed for our flu season, and then I'll just talk through some of the, can you guys see that okay, or do I need to make it bigger?
I can see it.
No, I can see it.
Okay. So it's already flu season. So we have been working diligently to plan our community-wide flu clinics. And so as you see on the screen, we have 2 large community clinics coming up in October, one for Tuesday, October 24th from 5 to 7 at Brian McMahon High School. Big shout out to Brian McMahon for letting us host a clinic at their school. And then another clinic on Thursday, October 26th from 10 to 12 at the Norwalk Senior Center. Again, thank you to the Norwalk Senior Center for always opening their doors to us as well. After those 2 large-scale clinics, we'll have community clinics at the health department Thursdays in November. So on the 2nd, the 9th, the 16th, and the 30th, there won't be a clinic on the 23rd, and those will run from 1 to 3 p.m. Registration is required for all of those clinics. And so we have our clinics listed on our website. Our website is norwalkt.gov/flu, or they can call a vaccine line. We'll get me or Jalea on the phone. It's 203-854-7985. And we'll be able to help them register for those clinics online, but registration is required. And then a couple more details of the clinic. So ages, everyone 3 years and older will be able to vaccinate at the clinic. Children from 6 months to 3 years, they should, still get the vaccine. They should call their medical home to schedule that appointment. And if they need any help with that, we definitely can assist. So just call our main number. As far as the cost, we do take most insurances. They are listed on our website as well. And then for those who are paying out of pocket, the standard dose is $45, and the high dose, which is for folks 65 and older, is $75. Let me see. We just sent out postcards last week, so folks who have come to our clinics in the past would have received a postcard with this information. And so we're looking forward to having everybody.
Okay.
Anything else around flu shots, Deanna, you wanted me to mention?
No,
Or any
that
other
was
vaccines?
great. Thanks, Megan.
Okay.
Does anybody have any questions for Megan?
You'll see me there.
Thank you, Megan. All right, I'm gonna pass it on to Brian to give some FB updates.
Sure. Good morning again. Again, special shout out to Pam and Megan for that presentation. I just jumped in with the, my geographical analyses. But all right. Let's see. Let's pull it right up. Kind of the standard presentation. So again, we're covering respiratory illness season right now. With the main focus. So with that said, what you're seeing is the wastewater monitoring that we typically look at. More specifically, usually Fairfield County. But I'm looking at all Connecticut counties right now because again, I just want to kind of keep this in perspective as we kind of move further into the season because we're officially in fall now and we can definitely feel the weather to some degree as well in that regard, and not great given that it's much colder now and social distancing is going to be a little bit harder, things of that nature. So with that said, as you can see here, Fairfield County, in terms of the curve, this is looking at for the most recent 6 months. The concentration of COVID RNA inside the wastewater that's getting analyzed is going pretty much more or less on a kind of growth here. As you can see, it keeps going up. It's around the 800s. Hartford County, if you look at it to the right here, kind of also showed some growth as well, but it's not as high as Fairfield County. And the other county that's kind of showed some of that growth as well is New London County, although it's dipping at the moment. So those are the three counties that, so far have been kind of really steadily increasing and noticeably. You still have Middlesex and New Haven counties that are kind of hanging in there, but keep in mind that New Haven County also, their surveillance relative to this wastewater monitoring via BioBot, the company, that has kind of concluded. So unfortunately, it's creating a little bit of a gap in terms of these comparisons. So New Haven County also being one of the more populous counties in the state. So with that said, just to summarize this, Fairfield County is definitely on the incline compared to the other counties. We're the highest at the moment in terms of concentration for COVID RNA inside the wastewater. But still, we have Hartford and New London counties that showed some uptick. And so, this thing is going to kind of jump back and forth and something very much just to keep an eye on because 'tis the season and we're getting closer to where things kind of really pick up. So that's just important to keep in mind. And then, in the context of the CDC, new COVID hospital admissions rate per 100,000 for the last 7 days. You can see how it's kind of a mix of counties here. Still majority, obviously, in the green, so you're around 89, if not 90%. But as you can see, the Midwest, the Southeast, even the Southwest to some degree, Mid-Atlantic, you can see there's counties in the yellow or moderate. And so that is, something very much that's a concern. And then also even some, only about 0.37% that are in the orange, or the high. But noticeably in the Northeast there, we got Vermont and New Hampshire that do have, a couple or a few counties actually in that moderate level. You can see how, especially also with, Vermont and upstate New York, also at that moderate in terms of the yellow. So not great that we're seeing that kind of activity. Connecticut so far hasn't entered that. We're still in the green for our counties, fortunately, but it's something that we have to just be mindful of because, just a few weeks ago, this was predominantly centered more so in maybe the Midwest and the Southeast, but it has been slowly creeping forward in terms of the Northeast and growing. And so that's important because that's a measure for severity and also as an indicator for kind of what we do in terms of other, prevention measures. But still, all prevention measures apply in terms of, people being mindful of social distancing, organizing events as they see fit, especially those that may be more susceptible to illness with pre-existing conditions, things of that nature. Obviously following up with their healthcare provider or taking other prevention measures such as, wearing face masks and things of that nature. Again, it's still kind of that flexibility and, decision-making relative to oneself in terms of taking those proper precautions. And then obviously the best thing being the vaccines as well. So with that said, just looking at the subvariant kind of situation really quickly, there's a huge potpourri that keeps growing in this mix here. But right now, about 25% or a quarter is EG5. Then you got FL151 at about 14%, and the XBB still circulating, 116, 116.6 at 10.2 and 9.9%. So again, this is just going to be constantly changing as we've kind of seen and kind of anticipate, especially as we move forward into higher activity relative to COVID-19. And you'll see, regionally speaking, the same story plays out because, there's a slight change in proportions relative to, say, the West Coast versus the East Coast, relative to the regions that the CDC is supplying the surveillance. But more or less every variant, once it's out of the box, so to speak, it makes its way throughout the country. And so that's something that's very important to keep in mind. So if there is one that's going to obviously be very high concern, that's something that we got to be ready for, because inevitably it'll probably make its way to us. At the moment, in terms of just the different variants you may be hearing it, or subvariants you're hearing about in the news, yes, some of them may have higher infectivity compared to others, but fortunately, so far, there's no indication that they fully neutralize any of the prevention measures, especially the vaccines at the moment. So we're still in a good spot, a very good spot. And so, as more of that information, gets better understood, we'll share it out. But, it's still very important that those prevention measures, again, the vaccines, really kind of help mitigate a lot of this. And so that's going to be just really important. So as you're probably hearing, I'm hitting that point home, because that's really something also the CDC has been hitting home as well. Again, from the national forecasting standpoint for COVID-19, you can see how it's a gradual uptick moving forward into October based on their forecasting. And as you can see, even right now with the weekly emergency department visits for all ages, you can see COVID still is kind of on the higher end. It's showing a little bit of a dip, but don't let that fool you, because likely that's the result of things having settled down to some degree from schools starting up, from Labor Day and other weekends and holidays. And so just be mindful of that. But if you break it down by age group, you can see how even like influenza and RSV are slowly growing as well in the mix. So respiratory illness season is definitely starting to show itself. And so with that said, this is looking at RSV. If you look on the right-hand side chart here, this is, essentially the antigen detections relative to state of Connecticut for RSV. And you can see how, again, where we were, the last time when we had the triple-demic, but where we are right now in the bottom right here. And you can see how it's slowly upticking as well. So state of Connecticut is no exception to what's happening in national trends. And then the same thing here for influenza. You can see how this is influenza-like illness. So this is syndromic surveillance, which is not perfect because it's looking at syndromes. It's looking at, symptoms essentially. And so sometimes it may capture other respiratory illnesses, but it's still helpful actually as an indicator what's going on respiratory illness season-wise. But still, it's a little bit more specific towards influenza. So with that said, as it's been for the last few weeks, influenza has been growing. And you can see here in the Southwest, especially Texas now, but also the Southeast, that proportion is growing because you see the milder colored green, if not entering kind of that yellow territory. You kind of have the uniqueness with Wyoming also being very high as well. In terms of the cities, though, New York City is also still moderate activity. And then, DC or District of Columbia is actually in the red or high at the moment. So, and then also you can see here in terms of Connecticut, actually, we're in the lighter shade of green for the minimal side. So again, taking the context how this is playing out, again, it's going to come from the Southeast, the South in general, make its way up to the Mid-Atlantic and also the Northeast. And we're seeing that for most of the respiratory illnesses. And, again, flu is also a kind of an indicator of that as well. So that's just really kind of important for all of us to keep in mind. Again, it's happening. It's just slowly happening. And then finally, this is from the CDC Center for Forecasting and Outbreak Analytics. So this is kind of a newer division. It's really quite fascinating, actually. And they published recently kind of their assessment for the respiratory season outlook. More or less, just to summarize, because they did a lot of different modeling and kind of assumptions and things that they tested out. More or less, they anticipate at least a moderate COVID-19 wave for this season and normal kind of influenza RSV activity, but don't overlook what that really means. That means just like what we had prior to COVID, those influenza and RSV waves kind of playing out similarly. They don't anticipate having an RSV wave like we had last year or last season, in the sense that it was very acute and very concerning because, again, there was just a lot of susceptibility given the very serious prevention measures that we were following that kind of mitigated the normal activity for RSV. But with that said, the CDC has anticipated at least two scenarios. They're focusing on these two right here, scenarios A and B. So scenario A is, moderate influenza and RSV season, along with a moderate COVID-19 wave, which is obviously going to be a lot more manageable in terms of new hospitalizations. And so that's the one we're kind of hoping for. And this is what, one of the scenarios that they're anticipating. But there's also the possibility of scenario B, which is severe influenza and RSV season, moderate COVID-19 wave, which more or less results in kind of overlapping peaks, which is going to really overwhelm the healthcare system and in terms of hospitalizations. So, that, also is still a possibility, but they're hoping that it's not. And so we just got to keep this in mind, be mindful of it in terms of as we move forward in the season, that it still could be a very complex scenario in terms of how things play out. So we don't want to assume too much, but at least we have kind of these forecasting models from the CDC preparing us for this, and the likelihood of this happening. So just want to kind of emphasize those points. So that's kind of just the update relative to the respiratory illness season. Preparation is going to be the best thing, as well as the prevention, and especially the big thing being the vaccines that we have for all three of the triple-demic viruses, again, for COVID, flu, and RSV. So I think that's really the most important point, and the CDC has really kind of laced that into their messaging as well. That's the update for respiratory illness season. Thanks, guys.
Thank you so much, Brian. Does anybody have any questions for Brian?
No, thank you, Brian.
All right, thank you, Brian, as always, for a really great presentation. Okay, our next item on the agenda is the policies and procedures for public pools. So this is a policy that had been in the works for a while, and thank you to Bill and Aniela for working on this and finalizing and putting it together for your review. I know, Terry, you had some questions and comments, so I just want to pass it on to Bill and Aniela. Do you want to make any introductory comments about the policy before we hear from Terry and the other board members?
No, not from me right now, no.
Okay.
Aniela?
No, I think that the policy pretty much speaks for itself. Took a couple looks at your initial comments, Terry, and happy to hear you kind of flesh them out.
All right, I'm going to pass it on to you, Terry.
Thank you. This is a great policy. And you guys did a really wonderful job doing all the paperwork on it. I just had a couple of suggestions, and it's similar to suggestions I've had in the past with other policies. One, under the policy statement, it does say something about correcting violations within a reasonable time frame, which you may want to specify, because there is a place on the form that gives a date. So there's some interpretation as to what a client might say is reasonable versus what you all might say. So I might just revise that language a little bit. And then
Well,
just
can I just address that a little bit, Terry?
absolutely, yep.
So the reason for the reasonable time is it depends on what the violation might be. If it's something that's immediate closure, then you're going to close it down. It behooves the manager to turn it around as quickly as possible to reopen it. So we'll check the water levels again. If it's something such as, maybe there's some ceramic wall tiles missing somewhere, you can give them another, so that compliance date will suggest that if required. So it gives some flexibility to the inspector depending on what it is. If it's something severe, like in other words, if there's some life-saving equipment that's missing, that's something you would want to do immediately. And there's a number of things we look at. Some are clearly more important than others in terms of the quality of the water, number one. And then let's say the fencing was damaged or something, you want that repaired immediately. So you want some flexibility and be able to assess a compliance date or time.
Yeah, that sounds fine and very reasonable. I would just thinking as a person who might be the owner of the pool, which I don't have one, they might disagree with you about what's reasonable in that paragraph. So you might want to just say reasonable based on the type of violation or something like that, so that they can't say, well, that's your opinion of what's reasonable. You know what I mean?
Yeah.
So,
okay.
Yeah, but I agree that makes sense that you would have a different time frame based on what the violation is. Yeah.
Correct.
And then I just had a question, just a point of information on the construction. I know the plans, it says go to the Department of Health, which sounds great. I just wondered, do they also go to the city? I just don't know how that works for putting a pool in.
Yeah, the state health department, they're responsible for the sole approval and review of plans. Now they'll give us some as the courtesy, but they're the ones who are responsible for the review and signing off on pools.
Okay, very interesting. That's something I didn't know about. Okay, great. If I ever decide to put a pool in, I know.
Well, now, if you're doing a personal pool, that's different. These are public pools. That
Right,
we're
right.
talking. Okay.
Oh,
yeah.
right.
Now, a
Yeah.
public pool, you'd have to do with us anyway, because if you have a septic system, we'd be looking at that anyway. So that's different.
Right.
But in terms of approval, it's really up to the owner to do it if it's just a private residential.
Uh-huh. Good to know. Okay. And then I just had a couple of suggestions in terms of the licensing. Because this is a policy that we probably will keep for a while, we don't want to have to go back into the policy if we change software or if we change something else. I can't remember what the other thing was. So you might want to just look at that and see. You might want to just remove the name of the software company and just say the environmental software or whatever. And I think
There was a room number that you wanted us to remove as well.
yeah, well, I mean, you don't have to remove it. I'm just saying if you move things, then technically you're out of the policy compliance. So anything that you could do to just make that, you know, whatever the room is supposed to be, that people would know, that the sanitation folks would know. And then there was a piece on the actual procedure of how you would do the testing. And I'm not sure you need to have that in the policy, because if you change to a different kind of test kit, it might be a little different format. So it was so many drops of chlorine solution and match the color. And so you might, I'm not sure that needs to be in the policy section, but certainly it's a procedure that the staff would need. So that might save you some aggravation changing the policy if we had a change in the testing kits.
I have a thought based on what you're saying, Terry. You know, we had written in the policy of policies that if we include things as an addendum or an attachment, because knowing that those, like those references might change, that we don't need to go to the full board for approval of those revisions. So what if we put some of these very specific things into like an attachment or addendum as procedure steps? Would that work?
Sure, yeah, whatever works for you folks. I'm just thinking in terms of, you know, if I don't know if these are public, but if somebody wanted to see your policy and then you have the wrong information in there because you've changed the test kit for whatever reason, but however you want to handle it, I'm just thinking in terms of less work for you if you have to a change in a product or something.
Great, thank you.
And then my only other question was, let's see, it's number 5, I guess under the procedure steps. And it says you would give a copy to the pool manager and review the report, and if they're not there, you send it. So I just wondered, like, if somebody else is there, like, would you give them a copy? Or I don't know, it was just a question that I had.
I would say it depends on the venue. Typically we want to give it to the certified pool operator. They're the ones who are directly responsible for the operations of the pool, so we want to do that. Now if they're not there, and let's say it's I don't know, if it's a condo, I wouldn't do it, for instance, because you want to give it directly to the certified pool operator. If it were you know, at one of the school pools, then I would probably give it to a supervisor, because that will in turn go to the responsible person. So it kind of depends on the venue who you would give it to, but we always send out those via mail anyway, unless there's a closure. Now that's entirely different. If we close something, we're going to go right to the CPO immediately.
Right,
Otherwise,
okay.
we would mail it out, and you know, like I said, it kind of depends on the venue.
Yep.
Generally,
So
I wouldn't do it because you want to make sure the right person gets it. You don't want it to like disappear and they never get the information.
Right. So is there's a certified pool manager for, okay.
Each
All
pool
right.
has to have one. That's correct.
Ah, good to know. Okay. You might want to stick that word in there. And then that would make sense that it goes to the certified person. Yep. Okay.
Okay.
Yeah, that makes perfect sense. And I think that was my only comments.
There was one thing about a pool, the reinspection fee. We don't have one.
Oh, yeah. I don't know, maybe
we'll just go back and ensure that it's done. And we haven't done a reinspection fee or talked about it in the past anyway, that I'm aware of.
Okay. Yeah, just curious. And how many times can they not be in compliance?
Well,
So if
So
you go
usually-
back and re-inspect and they're
Yeah, we
still
go
not
back,
in
well,
compliance.
especially like if it's a closure, they're not gonna reopen until we go verify that, let's say the chlorine
Right.
levels are adequate. So we're gonna go back no matter what. The other ones, it depends on really what it is. If it's a really minor thing, we don't want to live long. I like to try and give them 60 days to fix anything. You know, let's say like I mentioned, like, you know, something in the shower, maybe there's some tiles missing. I like to
Right.
so we'll go in, our initial inspection is in June, and we'll go back, generally speaking, if everything else is good, go back in again in August. And then we want to give them that 60 days to repair it, which is plenty of time for most minor things.
Sure. Okay. Sounds good. Great. Thank you.
You're welcome.
Thanks, Terry. Are there any other comments or suggestions, revisions, questions about the policy?
No.
So what do you think about a motion to approve the policy with those revisions, like the reasonable time frame based on the type of violation, remove some more of the specifics and put them in procedures? Do you want to see this? Do you want us to make those revisions and bring them back to you next month? What would you like for us to do?
I don't personally feel the need to see them again. They were just suggestions on my part, so I would be okay with approving it with corrections. I don't know how other folks feel.
I agree.
I think that's fine.
Okay, great. Thank you. So do I have a motion to approve with those corrections?
So moved.
Terry moved. Do I have a second?
Second?
Janet, I think got first. Thank you. All those in favor, say aye.
Aye.
All approved. All right. Thank you so much. And thanks, Bill. Thanks, Danielle. And thank you, Terry, for your questions and your revisions.
Thanks for all the hard work on that.
Yeah.
All right. Expect more policies because I have a whole bunch in my queue that I have to review. So you'll be getting more. I appreciate it.
Yay. I
Um,
love policies.
So just a few quick updates from me on my end. Our staff have been they've been planning for the flu clinics, as Megan has been updating. You know, she has a weekly meeting that she facilitates with staff to plan for clinics. And this group is also looking at offering COVID-19 vaccines as well. So I just want to let you know that we're looking into it. As you know, it's moved to the private market, so it will require us to purchase the vaccine. So we're currently looking into the pricing of, you know, purchasing and then what our reimbursement would be like. So we're trying to get all the information on the insurance side so then we could present it to you all and to the mayor for feedback on, because it would require a special appropriation because we don't have the money budgeted for it within our vaccine line. So would love your input on this. We have had a few like congregate living facilities reach out to us wanting us to vaccinate. You know, we had vaccinated them before. We are also in the process of enrolling in the Bridge program, which would allow us to offer vaccines to the uninsured at no cost. So we think it's important to be able to provide this to be you know, a site in the community for vaccination. But we just want to make sure we have all the information to present. I don't know if anybody has any general thoughts about it, but now or later, I'd love for you to share them with me. I also want to let you guys know that we've been also busy distributing COVID-19 test kits. We partnered with Mary Oster. She was able to distribute, I think, 800 test kits to daycares and early childhood providers. We had gotten free test kits from the state, as well as some of our other key partners. And we're in the process of purchasing more at-home test kits using grant funding that we got from the state. And I think this will be like our 5th distribution going out to community partners and members. And that's in addition to the very large scale distributions that the Office of Emergency Management led back a couple of years ago with our assistance of the emergency response team volunteers and some of our staff. So we're also doing that, and then we're also promoting, you know, the test kits that are now available through the federal government through the mail. we just posted the WIC site nutritionist position. Monica is retired. She's been with the department for about 15 years. She was with our WIC program. And so we're looking to fill that position. We also have somebody part-time who's going to be working with Brian that's going to come on board to work in a temporary position using grant funding as a public health specialist / analyst position. And we're also just posted a part-time relocation / eviction services coordinator that's going to be working with Bill to assist with all the relocation that falls under his umbrella that he's been leading and running. So we're hopeful to have assistance for that and hopeful to have that person also assist with other inspections in the division. The ERT, we're under recruitment right now. We're gonna have the fall training sessions coming up, the fall class coming up soon. So we're recruiting for members. So if you know anybody, please send them our way. And I also just want to give you a quick update on the supportive work environment policy. I'll present like the findings at the end, but we've already had 2 out of the 5 sessions. We actually tagged on a 6th at the end because we've been having such great discussions with staff, and I want to thank Catalina, who's really enlisted and gotten more staff involvement. So it's not just supervisors, but it's really like people from the entire department being really open and honest with us about things that we're doing great and things that are pain points and that we need to improve. So I think this is really, really great, and I'm excited to be able to link this with the workforce development funding that we're receiving to really make some improvements and to continue to allow us to heal from the pandemic and just make an even better work environment for our staff. So that's been going really well. And I want to thank Danielle and Megan for their support on that as well, because they're helping me lead this. And those are my updates. Does anybody have any questions about the director's report?
I just have a question. You received an award recently, so I wonder if you just want to tell us a little bit about that, or I guess I don't know if it's called a award, but I think it's an award. I would call it an award. If you would just talk about that so we can get it into the minutes and let some folks know about it, because it sounds like a very, very prestigious honor, and we're very excited for you.
Thank you, Terry. I'm really excited too. So Danielle and Megan back in the springtime told me they wanted to nominate me for this award, the 40 Under 40 in Public Health. So the De Beaumont Foundation, which I'm such a huge fan of, they've really helped me grow as a public health professional, and they've really, I think, helped our department too. They're really forward thinking. They're really big advocates for local and state health departments, like the governmental public health system. They're really strong advocates of us, and they're also have helped us by providing us a lot of resources and tools to help us improve in order to ultimately, serve our community. So it's all about bold solutions to improve public health. And so they've come up with this 40 Under 40 recognition because they knew there was a lot of 40 Under 40s in healthcare, but not anything really in public health. So they established it in 2019. This is the 3rd class. And so I got accepted into the class of 2023. So it's recognizing leaders across the country who are either work in state or local health departments or help improve and support local or state health departments. So it's really cool that it has that focus on it. But what's really awesome is that it's a professional development opportunity. So it's 2 years of trainings. There's going to be a leadership retreat. There's going to be, potential opportunities for writing and just really developing more skills. So thank you for bringing it up, Terry. I'm excited. And thanks to Aniela and Megan for supporting me in this and for the staff. And really, it's like a reflection of everybody in our department, right? We have a really, really strong health department. It's been decades of being a strong health department. From our former leaders to our current staff, to our board, to our volunteers, to the city. Norwalk really is a special place. And so I'm glad that, we're recognized as being a leader in public health. So, all right, I think I've talked enough. Thank you, Terry.
Congrats, Deanna.
Thank you. All right. The last thing I'm going to talk about is public participation. And we had somebody submit a public comment to us. Megan, do you know if she wants us to read her name, or did she want us to stay anonymous?
No, she said she was fine.
Okay, all right. Her name is Dolores Downer, and she called in and wanted to just give some support to us. So she said it was related to vaccination. So I have a lot of faith in the health department. I come each year for my flu shot, and I know if I come to the health department, I will get the right dose and the right vaccine. In the news, they are encouraging people to get the flu shot and COVID booster together. I would like for the Norwalk Health Department to carry the booster vaccine. So she's in support of us, and she wants us to offer the COVID-19 booster. I don't see, thank you, Dolores, for submitting that. I don't see any other people from the public to participate, so I will close public comment.
It's nice to get some positive reinforcement for the hard work that you all do.
Absolutely. Thank you, Terry. All right. Any other thing before we wrap up? All right. It is 8:52 and we will adjourn. All right. Have a great day, everyone. Thank you.
Bye, everyone.
Bye-bye.
everyone.
Happy fall.
Have a nice few weeks, everybody.
You too.
Yeah, okay, see you soon.